Assalamualaikum. My name is Musa Irfan and I am a student of DNS. Today I am going to present my topic of evidence-based practice. What is meant by intention to treat analysis? So I will start my topic. First of all, intent to treat analysis is the gold standard of randomized clinical trials. In ITT analysis, data from all subjects initially enrolled in a clinical trial are used for the analysis of efficiency and safety in the view of the fact that the collected data may be incomplete and in view of the fact that some subjects have deviated somewhat from the instructions in the clinical study protocol. It is tempting to perform the analysis using only data from perfect subjects, where this analyze is called PP analyze. Intent to treat analyze and PP analyze can each introduce different bias into the conclusions regarding safety and efficiency. Intention to treat analysis, intention to treat analyze are contributive in an analysis by treat received as treated analysis. The effect of therapy is judged only in patient who actually receive the therapy. In an intention to treat analysis, the patients are evaluated on the basis of the group to which they were randomly assigned, regardless of whether they actually received the therapy. Or although as treated analysis may seem some intuitive, they have the potential to introduce significant biases. Patients who do not adhere to a given therapy may differ significantly from those who do, and often have higher event rates that adhere patients. In addition to complements may not be balanced between groups, particularly from therapies with significant side effects. Thus, the exclusion of the subjects who do not continue the assigned therapy or for whatever reason tends to bias the interpretation toward a conclusion of greater efficiency of the therapy being evaluated, because only complement patients are studied. Such as an approach may confirm biological efficiency, but does not establish real world efficiency effectiveness. In clinical practice, the overall performance of given therapy must taken into account patients who cannot or will not adhere. 56 intention to treat analyze provided an estimate of treatment effects that tends to be more conservative, and in it remains the gold standard for interpretation of RCTs in studies with high rates of in complements. As treated analysis may performed as secondary analysis in order to investigate biological efficiency, but such analysis should be seen as supplementary to the intention to treat analysis. Now I will like to tell you modified ITT. A modified ITT analysis includes all randomized patients that meet a specific minimum standard of simple set of criteria. The criteria should be simple, objective, and very straightforward. The criteria should not be related to the outcome. For example, if you know that patients with lower socioeconomic status will be less likely to respond to your intervention, you cannot use socioeconomic status as a criterion. Using subjective criteria defeat the purpose of a modified ITT. The more common modified ITT will included all patients who received at least one dose of the study intervention, regardless of what happened to patient after initial dose. The study protocol should pre specify a modified ITT analysis and its criteria. Otherwise, selection bias can occur. Now, for example, if you find that a characteristic correlates with the poor intervention response, you could later exclude patient with that characteristic from analysis. Another common modified ITT analysis exclude all patients who had major protocol violation. For example, they did not meet the study selection criteria. Usually the primary analysis should be an ITT analysis, but in some rare cases, for example, non inferiority or equivalent trials, a modified ITT may be appropriate. Modified ITT analyses are relatively common for secondary or exploratory analysis. Determining whether to include sites with the protocol violation can be challenge. So this was all about my video presentation. I would like to thank my teacher who is teaching us evidence based practice. And I would also like to thank all my dear fellow students. So thank you very much. This was all about my presentation. Hope so you would like it. Thank you very much. Allah Hafiz.